I'm going to introduce a new concept, a relatively new concept, the relative energy deficiency in sport, or REDS or RED-S. And this kind of came from the concept of the female athlete triad. So the female athlete triad was kind of talked about in 1997. And then ACSM, American College of Sports Medicine, made a position statement, and it was defined as female athletes who had disordered eating, amenorrhea, and osteoporosis. Amenorrhea is a loss of menses, and osteoporosis is the clinical diagnosis of low bone mass that leads to fracture. In 2007, they updated the concept to be anywhere in the spectrum of low energy availability, menstrual function disorders or problems, and bone health issues. So it could go from osteopenia all the way to osteoporosis, or oleomenorrhea to amenorrhea, or on a spectrum. Then in 2014, the IOC, or the International Olympic Committee, decided that they would introduce relative energy deficiency in sport, or RED-S, to incorporate all athletes, and that primarily energy deficiency was the key factor that created a lot of the problems that they were seeing in these athletes. So before we go into RED-S, let's look at the female athlete triad. And so this is in its broader form, and it kind of goes from healthy to unhealthy for energy availability, for bone health, and for menstrual status. So it has, from optimal menstrual cycles to hypothalamic amenorrhea. So it's on a spectrum. Same with bone health, from low BMD to clinical osteoporosis, and from optimal energy availability to low energy availability with or without disordered eating. Because remember, sometimes our energy availability does not deal with food, but our output or our activity levels. All right, so this is the RED-S, and you can see that the triad is part of RED-S, but it increased the issues that athletes could have, from cardiovascular to psychological to hematological, metabolic, endocrine, immunological, and gastrointestinal. And they always also say with this decreased energy or energy deficiency, you have a decrease in performance. All right. Now, I must say that this is fairly controversial, and the ACSM group, Female Athlete Triad Coalition, wrote a rebuttal to their 2014 position statement, the IOC's. So if you get into looking at this for who you're training or your interest, there's definitely controversy right now, but it will slowly get sorted out. But just be aware that there are two sides. You'll read different viewpoints depending on who you're reading. All right, I kind of like this image because it says it's the simplified endocrine response, and it's fairly complex, and so I would take some time to go through it. But it all focuses on energy deficiency and how it might affect IGF-1 going into bone, how it could affect leptin and insulin, glucagon and insulin, your metabolic rate. This gets into your hypothalamus, that goes into your pituitary, which deals with decreasing estrogen or testosterone, which could have an effect on bone. And this can also go towards cortisol increases that could affect your immune system. We also have effect on adipose tissue and your thyroid. So it's a fairly complex interaction, all coming from this energy deficiency. So when we're talking about energy deficiency, it's an area that looks at matching energy intake with energy demand. So it can be altered in two manners: either insufficient energy intake, right? So your energy demand for training exceeds your energy levels that you're getting from your food sources, or you can have excessive training load or excessive exercise or activity, which then overloads your eating